SAMHSA's concept of trauma and guidance for a trauma-informed approach. Part 2. This is prepared by SAMHSA's Trauma and Justice Strategic Initiative, July 2014. Background. Trauma. Where we are and how we got here. The concept of traumatic stress emerged in the field of mental health at least 4 decades ago. Over the last 20 years, SAMHSA has been a leader in recognizing the need to address trauma as a fundamental obligation for public mental health and substance abuse service delivery, and has supported the development and promulgation of trauma-informed systems of care. In 1994, SAMHSA convened the Dare to Vision Conference, an event designed to bring trauma to the foreground and the first national conference in which women trauma survivors talked about their experiences and ways in which standard practices in hospitals re-traumatized and often triggered memories of previous abuse. In 1998, SAMHSA funded the Women, Co-occurring Disorders, and Violence Study to generate knowledge on the development and evaluation of integrated services approaches for women with co-occurring mental and substance use disorders who also had histories of physical and/or sexual abuse. In 2021, SAMHSA funded the National Child Traumatic Stress Initiative to increase understanding of child trauma and develop effective interventions for children exposed to different types of traumatic events. The American Psychiatric Association, the APA, played an important role in defining trauma. Diagnostic criteria for traumatic stress disorders have been debated through several iterations of the Diagnostic and Statistical Manual of Mental Disorders, the DSM, with the new category of trauma and stressor-related disorders across the lifespan, included in the recently released DSM-5, measures and inventories of trauma exposure, with both clinical and research applications, have proliferated since the 1970s. National trauma research and practice centers have conducted significant work in the past few decades, further refining the concept of trauma and developing effective trauma assessments and treatments. With the advances in neuroscience, a biopsychosocial approach to traumatic experiences has begun to delineate the mechanisms in which neurobiology, psychological processes, and social attachment interact and contribute to mental and substance use disorders across the lifespan. Simultaneously, an emerging trauma survivors movement has provided another perspective on the understanding of traumatic experiences. Trauma survivors, that is, people with lived experience of trauma, have powerfully and systematically documented their paths to recovery. Traumatic experiences complicate a child's or an adult's capacity to make sense of their lives and to create meaningful, consistent relationships in their families and communities. Trauma survivors have powerfully and systematically documented their paths to recovery. The convergence of the trauma survivor's perspective with research and clinical work has underscored the central role of traumatic experiences in the lives of people with mental and substance use conditions. The connection between trauma and these conditions offers a potentially explanatory model of what has happened to individuals, both children and adults, who come to the attention of the behavioral health and other service systems. People with traumatic experiences, however, do not show up only in behavioral health systems. Responses to these experiences often manifest in behaviors or conditions that result in involvement with the child welfare and the criminal and juvenile justice system, or in difficulties in the education, employment, or primary care system. Recently, there has also been a focus on individuals in the military and increasing rates of post-traumatic stress disorders. With the growing understanding of the pervasiveness of traumatic experience and responses, a growing number of clinical interventions for trauma responses have been developed. Federal research agencies, academic institutions, and practice research partnerships have generated empirically supported interventions. In SAMHSA's National Registry of Evidence-Based Programs and Practices, the NREPP alone, there have been over 15 interventions focusing on the treatment or screening for trauma. These interventions have been integrated into the behavioral health treatment care delivery system. However, from the voice of trauma survivors, it has become clear that these clinical interventions are not enough. Building on lessons learned from SAMHSA's Women Co-Occurring Disorders and Violence Study, SAMHSA's National Child Traumatic Stress Network, and SAMHSA's National Center for Trauma-Informed Care and Alternatives to Seclusion and Restraints, among other developments in the field. It became clear that the organizational climate and conditions in which services are provided played a significant role in maximizing the outcomes of interventions and contributing to the healing and recovery of the people being served. SAMHSA's National Center for Trauma-Informed Care has continued to advance this effort, starting first in the behavioral health sector, but increasingly responding to technical assistance requests for organizational change in the criminal justice, education, and primary care sectors. Federal, state, and local level trauma-focused activities. The increased understanding of the pervasiveness of trauma and its connections to physical and behavioral health and well-being have propelled a growing number of organizations and service systems to explore ways to make their services more responsive to people who have experienced trauma. This has been happening in state and local systems and federal agencies. States are elevating a focus on trauma. For example, Oregon Health Authority is looking at different types of trauma across the age span and different population groups. Maine's Thrive Initiative incorporates a trauma-informed care focus in their children's systems of care. New York is introducing a trauma-informed initiative in the juvenile justice system. Missouri is exploring a trauma-informed approach for their adult mental health system. In Massachusetts, the Child Trauma Project is focused on taking trauma-informed care statewide in child welfare practice. In Connecticut, the Child Health and Development Institute with the State Department of Children and Families is building a trauma-informed system of care throughout the state through policy and workforce development. SAMHSA has supported the further development of trauma-informed approaches through its Mental Health Transformation Grant Program directed to state and local governments. Increasing examples of local level efforts are being documented. For example, the city of Tarpon Springs in Florida has taken significant steps in becoming a trauma-informed community. The city made its mission to promote a widespread awareness of the costly effects of personal adversity upon the well-being of the community. The Family Policy Council in Washington State convened groups to focus on the impact of adverse childhood experiences on the health and well-being of its local communities and tribal communities. Philadelphia held a summit to further its understanding of the impact of trauma and violence on the psychological and physical health of its communities. SAMHSA continues to continue its support of grant programs that specifically address trauma. At the federal level, SAMHSA continues its support and technical assistance. It focuses on prevention, treatment, and recovery from trauma. Other federal agencies have increased their focus on trauma. The Administration on Children, Youth, and Family, the ACYF, has focused on the complex trauma of children in the child welfare system and how screening and assessing for severity of trauma and linkage with trauma treatments can contribute to improved well-being for these youth. In a joint effort among ACYF, SAMHSA, and the Centers for Medicare and Medicaid Services, the CMS, the three agencies developed and issued through the CMS State Directors Mechanism a letter to all state child welfare administrators, mental health commissioners, single state agency directors for substance abuse, and state Medicaid directors discussing trauma, its impact on children, screening, assessment, and treatment interventions, and strategies for paying for such care. The Office of Juvenile Justice and Delinquency Prevention has specific recommendations to address trauma in their Children Exposed to Violence initiative. The Office of Women's Health has developed a curriculum to train providers in primary care on how to address trauma issues in healthcare for women. The Department of Labor is examining trauma and the workplace through a federal interagency work group. The Department of Defense is honing in on prevention of sexual violence and trauma in the military. As multiple federal agencies representing varied sectors have recognized the impact of traumatic experiences on the children, adults, and families they serve, they have requested collaboration with SAMHSA in addressing these issues. The widespread recognition of the impact of trauma and the burgeoning interest in developing capacity to respond through trauma-informed approaches compelled SAMHSA to revisit its conceptual framework and approach to trauma, as well as its applicability not only to behavioral health, but also to other related fields. SAMHSA's concept of trauma. Decades of work in the field of trauma have generated multiple definitions of trauma. Combing through this work, SAMHSA developed an inventory of trauma definitions and recognized that there were subtle nuances and differences in these definitions. Desiring a concept that would be shared among its constituencies, practitioners, researchers, and trauma survivors, SAMHSA turned to its expert panel to help craft a concept that would be relevant to public health agencies and service systems. SAMHSA aims to provide a viable framework that can be used to support people receiving services, communities, and stakeholders in the work they do. A review of the existing definitions and discussions of the expert panel generated the following concept. Individual trauma, results from an event, series of event, or set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and that has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being.